Sympathy
Hey
versus
guys, Boys
empathy.
here. Guys, in today's video, I'll be talking about empathy and sympathy. As healthcare providers, it's important for us to know the difference between sympathy and empathy, or the difference between being empathetic and sympathetic. So, sympathy is basically expressing feelings of pity or sorrow for someone, while empathy is about putting yourself in someone else's shoes and or understanding someone else's emotions. So, as healthcare providers, it's really important for us to be empathetic and not sympathetic. You trying to be sympathetic is going to be like you pouring more salt or some kind of spicy food in someone else's wound, in a patient's wound. So you don't have to be sympathetic. You have to be empathetic. Okay. So, guys, I'm really going to explain these terms to you guys by using a practical example. It's kind of a sad one that I've experienced in the health field. So there was this lady that she was shot at the arm and she was pregnant at the time. So when that happened, she probably went into unconsciousness and she lost her baby. And so she was rushed to the hospital, and the orthopedic surgeons, they did the part. They removed the bullet from her arm and repaired the fractured arm. And since this was a gynecological and obstetric case, because she's pregnant, so she was admitted in the maternity unit because she was stable, and she was admitted in the maternity unit, and she had to be induced probably at one point because the baby in her womb is dead. An IUFD, intrauterine fetal death, that's the condition. So she had to be induced as soon as possible in order to prevent her from getting infected, because there's a dead baby in her womb that can cause her sepsis. So when she was finally induced, imagine a lady being induced to get into labor, feeling labor pains, knowing full well that she's going to give birth to a dead baby. A baby who wasn't ill, who died as a result of a gunshot incident. So this kind of lady, definitely she's going to be cursing everything and everyone. So in such a case, you don't need to be sympathetic with her. You need to try your best, control your emotions, and be empathetic. Acknowledge her feelings, acknowledge the fact that she's hurting. Be patient with her. For example, if you want to do a vaginal exam, she needs to maybe lie on her back. Sometimes she's going to take some time to do that. Of course, it's not easy. She's one-handed at a time. It's going to take some time for her to get into that position. So you need to be patient with her. Don't go crying and cursing with her. Say, yes, God will punish them. Yeah, yeah.